Medical surgical cardiovascular systems. Now we're moving on to cardiomyopathy. And so the etiology of cardiomyopathy is simply the heart muscles are not working as well as they should because there's some underlying issue. And so this can be acute or chronic abnormal condition of heart function. And there are three basic types of cardiomyopathy. You have dilated cardiomyopathy, where the heart ejects less than 40% of the blood in the left ventricle. Normal is 70%. There's reduced cardiac output, and that leads to heart failure. You also have hypertrophic cardiomyopathy, and it's characterized by massive ventricular hypertrophy, which may cause obstruction of the left ventricle outflow, so the cardiac output decreases as well. And then you may have restrictive cardiomyopathy, and this is usually characterized by restrictive filling of the ventricles, so there's not enough fluid to be pumped out. Usually, cardiomyopathy affects the left ventricle. However, it could also affect both the atria and the ventricles. Some clinical manifestations for dilated cardiomyopathy can lead to manifestations of heart failure, depending on which ventricle is affected. Keep in mind, guys, that you have to remember which ventricle is found on which side. So, the left ventricle, if you have left-sided or left ventricular cardiomyopathy, remember that will back up into the lungs, right will back up into the body. You also have hypertrophic cardiomyopathy, and that will manifest in fluid retention and manifestations of heart failure, again, depending on which side is affected. And then restrictive cardiomyopathy. This will also cause blood to back up to the systemic or pulmonary circulation, depending on the ventricle or side being affected. Please remember that the R in right-sided whatever, the R looks like a B, so that should remind you of it backs up into the body. And the left side, or the left ventricle, the L stands for lungs. So all the manifestations are primarily focused on pulmonary issues. When the patient develops these type of conditions, they'll manifest shortness of breath, trouble breathing, especially with physical exertion. They'll have fatigue, swelling in the ankles, feet, legs, abdomen, and veins in the neck. So very similar to heart failure. The patient may also develop dizziness, lightheadedness, or fainting spells, or syncope during physical activity, and this is caused by the reduced cardiac output. Arrhythmias may also be experienced, and that's irregular heartbeats, and they can occur in many instances with cardiomyopathy. So some diagnostic tests include MUGA or MUGA, multiple gated acquisition scan, an electrocardiogram, ECG or EKG, cardiac markers, troponin, CK&B, myoglobin, and LDH levels, chest x-rays, echocardiograms, coronary angiography, CT angiography, MRI, a stress test, Holter monitors, myocardial perfusion imaging, which uses a radioactive tracer to assess blood flow, like I mentioned before, single photon emission computed tomography, and this is the SPECT nuclear imaging that provides detailed images of the blood flow throughout the heart. Medical management is something more that we're going to be focused on. So again, we give these patients are going to be mimicking signs and symptoms of heart failure. So we give furosemide, Lasix, hydrochlorothiazide. We give cardiac glycosides like digoxin to improve cardiac output. We give certain antihypertensives like beta blockers, ACE inhibitors, aldosterone receptor blockers like spironolactone. We can also give hydralazine, and nitrates are also pretty effective in the medical treatment of heart failure or valve issues, or cardiomyopathy. Dietary management, very similar to heart failure, low sodium. Remember to adjust potassium accordingly depending on the medication you're using. Furosemide depletes potassium. You want to increase potassium in the diet. Spironolactone, it spares potassium, meaning we keep it, so you want to limit potassium in the diet. And nursing measures include elevating the lower extremities when resting to promote venous return to the right heart. You also want to elevate the head of the bed if the heart issue is on the left side. Keep in mind that our nursing measures are to treat the signs and symptoms. So you want to decrease the physical activity. You want to promote rest periods as the patient's walking. You want to do things or have interventions that ease the patient's ADLs. When the patient is eating, you want to make sure that they drink fluids in between meals. Make sure that their food is not heavy because it's going to cause an increase in the cardiac workload. So the concept is you want to reduce cardiac workload for these type of patients. When people have cardiomyopathy, there's not really something we can do to fix the issue if the heart's already damaged. So this is one of those conditions where we're going to be looking for a cardiac transplant or heart transplant.